My name is Professor Julia Downing and I'm the Chief Executive of the International Children's Palliative Care Network. We are delighted that the Lancet Commission on Palliative Care has been published on Friday the 13th of October 2017, and this corresponds with our annual campaign #HatsOnForChildren's Palliative Care, as we try and promote the need for children's palliative care around the world. So there are various issues that are raised within the Lancet Commission report. One of the challenges for us is the need for children's palliative care around the world. We know that palliative care is a human right, and there should be no child, regardless of where they live around the world, who should suffer needlessly in pain and from other symptoms during that stage when they could benefit from palliative care. We also know that the majority of children needing palliative care are living in low and middle income countries, in countries where access to palliative care is at best limited and sometimes even non-existent. Within the Lancet Commission report, they talk about serious health-related suffering, and again we know that 98% of children with serious health-related suffering live in low and middle income countries. So the development and the provision of palliative care for children is a human right, and we need to be working to develop children's palliative care around the world. We know that the need for palliative care and pain control in children has largely been neglected in many parts of the world. We also know that palliative care is a core component of universal health coverage. We know that the need for palliative care and for pain control in children has largely been ignored, and yet it is part of universal health coverage. And it is great that this Saturday there will be a focus on universal health coverage through World Hospice and Palliative Care Day. We know that there are barriers and challenges to the provision of children's palliative care globally. Some of these are highlighted in the Lancet Commission report. They include issues around the lack of education and skills within healthcare professionals, issues around opiophobia, people being scared to use the strong analgesics such as oral morphine in children, issues around a focus on cure and not necessarily such on care, and issues around non-communicable diseases not being seen as a priority in many countries. And as many of the children with life-limiting and life-threatening conditions will have non-communicable diseases, then this has an impact on the provision of children's palliative care. We also know that caregiving for children with life-limiting and life-threatening conditions can exacerbate poverty, and many of the families in low and middle income countries are already poor, and so then having a child with such a condition and needing palliative care just exacerbates the poverty, and it just makes the spiral of poverty even worse. So there are several aims of the Lancet Commission. The first is to try and quantify the heavy burden of serious health-related suffering, and that's serious health-related suffering in adults as well as in children. The second is to try and identify and cost an essential package of palliative care and pain medication that should be provided in all settings, and within that to think about some of the issues specific to children. So what about medicines specifically for children? The third is to try and measure the unmet need of the use of opioids. We know that opioids are just being used in very few countries, and that there is a need to expand access to opioids so that children and adults can have their pain controlled. And the fourth is to outline global strategies to expand palliative care and pain control as part of a core component of universal health coverage. And I think it's important to note that whilst the Lancet Commission didn't focus specifically on children, but it looked at palliative care and pain control across the board, across all ages, there were attempts throughout the Commission to try and highlight some of the specific needs for children. So what about the findings of the Lancet Commission? Well, there were 5 key findings, and we'll look at those individually. Firstly, it was about the alleviation of the burden of pain and suffering and severe distress in palliative care, and to look at that in terms of a global health and equity imperative. So what were the key issues for children? Well, we know that worldwide the burden of serious health-related suffering in children is generally associated with 3 key conditions. Firstly, obviously HIV disease, then premature birth and birth trauma, and also congenital malformations. In low-income countries, more than 50% of the burden of paediatric serious health-related suffering is associated with HIV. So HIV is a key one. Obviously, there are a range of conditions, but those three areas are key. Firstly, HIV disease, premature birth and birth trauma, and then congenital malformations. So there is a key issue there in terms of the burden of serious health-related suffering in children, particularly in low and middle-income countries. We know that children and their families have specific needs for palliative care, that they are different from the needs of adults. And so in looking at the provision of children's palliative care, we need to be aware of those differences and those distinctions. The Commission also stresses that access to children's palliative care should be available globally, especially in low and middle income countries because of the high rates of need there. And yet it is in these countries that the gap between provision and need is the greatest. Within the Commission, they talk about 10 key findings around the integration of palliative care and pain control. I think in terms of children's palliative care, there were three areas within those 10 points. The first being that the expansion of palliative care to children has been slow, and so we need to catch up on this. It has been lagging behind that for adults, and whilst there is still a long way to go in equal access of palliative care for adults, there is still further to go for children. We need more training and more capacity building in children's palliative care. There are many places where there is no access to education and training, and so how can we look at providing that education and training so that the nurses, the doctors, the social workers, the teachers, all those working with the children and their family are aware about palliative care, have an understanding of it and have skills in that area. Third area to highlight is that we need more health systems related research on children's palliative care. If we look at research globally on children's palliative care, it comes from a few countries, mainly high-income countries, and yet we have a wealth of experience and evidence from other countries. And so we do need to put an effort into more health-related research into children's palliative care so that we can increase the evidence base, but importantly that we can learn from each other and share from each other. The second key finding is that there needs to be an affordable essential package of palliative care and pain control, and that needs to be available for everyone. And if we're talking about children, we need to make sure that we have access to the right medicines in the right formulations, at the right places, at the right time, so that children can access those. So as part of this, we need to cover the cost of morphine. We know that of morphine equivalent to cover the cost of serious health-related suffering in low-income countries, it's around $1 million. And that is nothing compared to the hundreds of billions of dollars that is put in to preventing drug misuse. And so the actual amount needed to provide access to morphine and other medications, equivalent opioid medications, is manageable. So we need to be looking at how that can be provided for low and middle income countries. The third finding is that low and middle income countries can improve the quality of life of those in their countries who are the most poorest by bringing in this essential package of palliative care and pain control. And it can make such a difference to the lives of children and their families needing access to palliative care. Fourth, we need international evidence and international collaboration to expand palliative care, and that's particularly true in children's palliative care, and hopefully through the International Children's Palliative Care Network we can help to support and develop that collaboration. Then finally, we need better evidence and priority setting tools for palliative care so that we can measure progress, so that we can see the development of children's palliative care, where we are now, what we need to do to move forward, how we are moving forward, and then to show the developments in years to come. So we need these tools to enable us to do that. So what about the recommendations from the Lancet Commission, and what do they mean for us in children's palliative care? So one of the recommendations is that the future global efforts to develop a metric of serious health-related suffering has a focus on children, and we really look at children's palliative care and pain and how we can improve access to palliative care and pain control for these children. Another recommendation is that the World Bank, the Global Fund, the World Health Organization and UNICEF take a lead to develop a fund to help us to develop access to palliative care and pain control, particularly for medicines around the world for children. Another recommendation is that countries should build on and expand access to the essential package for palliative care and pain control, and that they should pay a specific notice to looking at the needs of children and what is the essential package for children and other vulnerable communities. And then in terms of what happens next, the recommendation is that there is an afterlife group that is being developed of key global advocates, including the International Association of Hospice and Palliative Care, the Worldwide Hospice and Palliative Care Alliance, the International Children's Palliative Care Network, working with regional bodies, working with other key stakeholders to try and look at the implementation of the recommendations from the Commission, and to make sure that the Commission is not just a paper exercise, but that we really see movement and see development in children's palliative care after the Commission itself. And so, as part of that afterlife group, we will be working hard to make sure that this recommendations from this Commission really do make a difference to the provision of children's palliative care globally. And then finally, there is a call for future Lancet Commissions to be undertaken and to have a focus specifically initially on children and also on palliative care in humanitarian situations. So there really is a key focus on what is needed to take children's palliative care to the next step, to the next level in countries all around the world, and especially in low and middle income countries. So at the International Children's Palliative Care Network, we are excited by the publication of this commission, and we will be working with the Afterlife Group, with the commissioners, with key stakeholders globally to try and implement some of the recommendations of the Commission and to try and make sure that we do work together to improve access to palliative care and pain control for all children around the world who need it. Thank you.